Welcome back to Senior Health Fixed, where your well-being is always our top priority. If you've been told your creatinine levels are high, or you're worried about kidney function as you age, you're not alone, and you're in the right place. Today, we're diving deep into a topic that's both urgent and empowering: the fruits you must eat to help your kidneys, and the ones you must avoid to prevent making things worse. Let's face it, kidney health can be a quiet troublemaker. Most seniors don't even realize their creatinine levels are creeping up until symptoms like fatigue, swelling, or decreased urine output start becoming daily annoyances. But here's the good news: sometimes managing or even reversing the damage starts with something as simple as the fruits you put on your plate. You've probably heard the saying, "An apple a day keeps the doctor away," but did you know that some fruits can actually be dangerous for those with compromised kidney function? That's right. While fruits are often considered the healthiest snack around, not all of them are safe for seniors, especially when high creatinine is in the picture. Why is creatinine important, anyway? Creatinine is a waste product that's produced when your muscles break down a compound called creatine. Normally, your kidneys filter it out of the blood and get rid of it through urine. But when your kidneys are overworked or damaged, creatinine starts building up in your bloodstream, and that's where the real danger begins. High levels of creatinine usually point to reduced kidney function. For seniors, that's particularly concerning because kidney health naturally declines with age. The last thing you want to do is unknowingly make things worse by eating the wrong foods or missing out on the right ones. So, what can you do? Well, it turns out that some fruits act like little kidney helpers, reducing inflammation, lowering your body's toxic load, and keeping blood pressure under control, all of which help your kidneys perform better. Meanwhile, other fruits, especially those high in potassium or oxalates, can make kidney function worse and send your creatinine levels skyrocketing. Now, here's the twist: some of the healthy fruits you've eaten all your life, like bananas and oranges, may actually do more harm than good if your kidneys are struggling. Surprised? You're not alone. That's why in today's video, we're going to break it all down in plain language: 5 common fruits that can help lower creatinine, and 7 fruits you should avoid at all costs if you care about your kidneys. Before we jump in, make sure to grab a pen or hit that subscribe button, because you'll want to remember this list. These simple changes could make a huge difference in your kidney health, and even help you avoid dialysis in the future. So, let's start with the fruits you should welcome into your kitchen, the ones that can help support kidney function, reduce creatinine levels naturally, and leave you feeling more energetic and in control. The first fruit on our list is red grapes. These small, sweet gems are more than just a snack. They're loaded with antioxidants, especially a powerful one called resveratrol. Resveratrol has been shown to reduce inflammation and protect the blood vessels in your kidneys. Plus, red grapes are relatively low in potassium compared to other fruits, making them a safe and supportive choice for seniors managing creatinine levels. Next up is blueberries, a true superfood. These little blue wonders are packed with anthocyanins, compounds that fight oxidative stress and support kidney health. They're also low in sodium, phosphorus, and potassium, 3 minerals that can wreak havoc on the kidneys if consumed in excess. Whether fresh, frozen, or blended into a smoothie, blueberries are a must-have in your weekly routine. Another fruit you should definitely keep in your fridge is apples. Yes, the classic apple: crisp, refreshing, and quietly powerful. Apples contain a type of fiber called pectin, which helps reduce cholesterol and control blood sugar levels. But here's what matters most: pectin also helps reduce the load on your kidneys by binding with toxins in the digestive tract and removing them before they ever reach your bloodstream. That's less work for your kidneys, and a better chance for your creatinine levels to stabilize. Moving on to cranberries, specifically unsweetened cranberries or pure cranberry juice. Cranberries are best known for urinary tract health, but their benefits go beyond that. They help prevent bacteria from sticking to the urinary tract, lowering the risk of infections that can strain the kidneys even more. On top of that, cranberries have anti-inflammatory compounds that may reduce overall kidney inflammation and support healthy filtration. Now here's a fruit that might surprise you: pineapple. Most tropical fruits are loaded with potassium, but pineapple breaks the rule. It's low in potassium but rich in fiber, vitamin C, and an enzyme called bromelain, which helps with digestion and reduces inflammation in the body. For seniors with kidney concerns, pineapple can be a delicious alternative to high-potassium fruits like bananas or mangoes, which, by the way, we'll talk about soon. That's 5 kidney-friendly fruits that don't just taste great, they also work silently to support your body's filtration system, reduce inflammation, and keep your creatinine levels from spiraling out of control. But as with all good things, moderation is key. Even healthy fruits can cause issues if eaten in large amounts, especially for those with advanced kidney disease. That's why it's always smart to speak with your healthcare provider before making big changes to your diet. Now, let's switch gears. Because not all fruits are safe, in fact, some are downright dangerous if you're dealing with elevated creatinine or chronic kidney issues. And here's where things get tricky. Many of these fruits are commonly recommended as part of a healthy diet. But for seniors with kidney concerns, they may be doing more harm than good. The first fruit to be cautious about is the banana. Yes, bananas are loaded with potassium, and while potassium is essential for nerve and muscle function, too much of it can be deadly for someone with reduced kidney function. When your kidneys can't filter potassium effectively, it builds up in the blood, leading to symptoms like irregular heartbeat, muscle weakness, and even heart failure. Just one medium banana has about 400 milligrams of potassium, and that adds up quickly. Next on the list is the orange, and especially orange juice. Oranges are acidic, high in vitamin C, and packed with potassium, around 240 milligrams in just one small fruit. That's not outrageous, but when combined with other high-potassium foods in your diet, it can tip the balance in the wrong direction. Orange juice is even more concentrated and easier to overconsume, making it a hidden risk for kidney patients trying to keep creatinine levels under control. Coming in at number 3, avocados. This one shocks people all the time. Yes, avocados are considered a superfood, full of heart-healthy fats and fiber, but they're also sky-high in potassium. Just half an avocado can contain over 350 milligrams of potassium. If you're eating guacamole regularly or adding avocado to your morning toast, you could be putting unnecessary stress on your kidneys without even realizing it. The fourth fruit you should be very cautious about is the kiwi. This fuzzy little green fruit is delicious and nutrient-rich, but it's also quite high in potassium. Many people don't associate kiwi with kidney risk, but just one medium kiwi can have over 200 milligrams of potassium. If your doctor has advised a low-potassium diet, kiwi is something you should either limit or skip entirely. Then we have dried fruits, and this includes raisins, prunes, apricots, and dates. These concentrated snacks may seem harmless, but they pack a punch in terms of potassium and sugar. The drying process removes water, making the nutrients and the risks more concentrated. Just a handful of dried apricots can contain over 1,000 milligrams of potassium. That's nearly half your recommended daily intake for someone on a kidney-friendly diet. The sixth fruit that seniors with high creatinine should be extremely cautious with is the melon family, especially cantaloupe and honeydew. These juicy fruits are summer favorites, and while they're hydrating and sweet, they're also very high in potassium. 1 cup of cantaloupe cubes can have nearly 430 milligrams of potassium, more than a banana. That might be fine for someone with healthy kidneys, but for a senior with impaired function or rising creatinine levels, that's a risky number. And remember, because melons are easy to eat in large quantities, it's all too common to overdo it without even noticing. And finally, the seventh fruit to avoid or strictly limit is the pomegranate. This one's tricky because pomegranates are often touted for their heart benefits and antioxidants. And while all of that is true, they're also a double threat for people with kidney issues, high in potassium and phosphorus, both of which are difficult to filter when kidney function is impaired. Pomegranate juice, in particular, is highly concentrated and can quickly push your potassium intake past the safe limit. So while the intentions may be good, this is a fruit best left out of your daily diet if your creatinine is high. So let's take a moment to recap where we are so far. We've covered 5 incredible fruits that support kidney health: red grapes, blueberries, apples, cranberries, and pineapple. All of these are low in potassium and phosphorus, and rich in antioxidants that reduce inflammation and oxidative stress, 2 of the main drivers behind kidney damage. On the flip side, we've uncovered 7 fruits that could be doing silent damage to your kidneys: bananas, oranges, avocados, kiwis, dried fruits, melons, and pomegranates. While they might be healthy in general, they're dangerous for seniors trying to keep creatinine under control, and that's a crucial distinction most people never hear from their doctors. But here's the most important point of all: diet isn't just about cutting things out, it's about strategic nourishment. When you understand how certain fruits interact with your kidneys, you take control of your health instead of letting lab reports control you. And if you've been dealing with high creatinine, you probably know how overwhelming it can feel. One blood test can turn your life upside down, and suddenly you're worried about dialysis, medication side effects, and worst of all, the unknown. But food is power, and the right fruits, chosen wisely, can not only slow down kidney damage, they can actually support your body's ability to heal. Think of every bite as a small but powerful decision. Am I helping my kidneys right now, or am I putting them under stress? That question can guide everything you eat from this point on. And while fruits are a great starting point, your whole lifestyle matters. Drinking plenty of water, especially pure, filtered water, helps your kidneys flush out waste more effectively. Staying active improves circulation and oxygen flow to the kidneys. Managing blood pressure and blood sugar is absolutely essential. And of course, limiting salt, processed foods, and excess protein can prevent your kidneys from working overtime. But don't underestimate the small stuff, like choosing blueberries over a banana, or swapping out that glass of orange juice for a handful of red grapes. These small decisions build momentum, and when you make them consistently, they lead to real, measurable improvements, not just in your creatinine levels, but in how you feel every day. At Senior Health Fixed, we believe that knowledge is the first step toward healing, and you've just taken a big one. If you've been living with high creatinine or worried about your kidney health, remember this: your body wants to heal. It's built to recover, to adapt, and to protect you, but only if you give it the right fuel. The fruits you choose matter more than you think. Every apple, every blueberry, every small swap you make adds up to something powerful. These aren't just diet tips, they're life tools. Your kidneys are working hard for you, every minute of every day. It's time to return the favor, so don't be discouraged by the foods you need to limit. Instead, feel empowered by the ones that can help you thrive. You're not just avoiding damage, you're actively creating better health, more energy, and more freedom to enjoy the things that matter. And if you found this video helpful, don't keep it to yourself. Share it with a friend, a parent, or someone you love who might be quietly struggling with the same issues. You could be the reason someone else avoids dialysis or finally gets their energy and clarity back. Make sure to subscribe to Senior Health Fixed and hit that notification bell so you never miss a video that could change your life. We've got more powerful, senior-focused health tips coming your way, simple, science-backed strategies that work with your body, not against it. Until next time, take care of yourself, stay curious, and remember, your health isn't fixed until you fix it.